Let me take you to the hospital of the future, a place where artificial intelligence is fully integrated with the care you receive, where it monitors a baby's first breath, where it tracks the rhythm of a patient's heart in the ICU, where it amplifies, not replaces, the voices of doctors. Sounds pretty cool, right? Well, I'm here to tell you this isn't the future. It's happening today, and it's happening at that intersection we talked about of artificial intelligence and medicine. Good afternoon, my name's Puneet Sharma, and I've spent my entire career at this dynamic crossroads. My first role is that as a neonatologist, which is a fancy way of saying that I'm a doctor who takes care of babies. The second is as a researcher, where I develop AI algorithms to hopefully improve outcomes in these vulnerable patients. But today I was hoping to combine both of those roles, to talk about how we can use AI responsibly in medicine, not just to advance technology, but to ensure that it serves humanity in ways that are ethical, equitable, and transformative. Because let's face it, medicine is beautiful in its complexity, but a little bit problematic in its delivery. I think anyone who's been to the doctor's office recently could probably tell you that, but either way, let me paint a picture for everyone. And imagine an overworked nurse in the NICU, the ICU unit for babies that I work in. They're trying their best to balance alarms from the monitors, charting on their patients, and counseling that anxious family who just wants to know if their baby's gonna be okay. Across the hall is a young doctor, similarly overwhelmed by the flood of patient data coming at them, trying their best to connect the dots in time to diagnose that sick baby with the limited resources at their disposal. Sounds kind of stressful, right? But this is exactly where AI could help. But before we get any further, we should probably be honest with ourselves. The phrase artificial intelligence evokes some mixed reactions. Some excitement, other skepticisms, and even fear. Will it understand the nuance of medicine? Will it perpetuate the biases that already exist in our system? Will it replace that human touch that defines the care that we receive? These are all really valid concerns, and they require thoughtful and deliberate answers. So I guess it's pretty fitting that we're at a TEDx event then, because I have an idea that I think is worth sharing. AI in medicine is not just about technology. It's about trust. It's about building systems that promote transparency, accountability, and fairness. It's about ensuring these systems enhance patient care, but never cause undue harm. Or in other words, it's about keeping humanity at the heart of innovation. And it's this idea that inspires everything I do, from patient care to research. So let me take you into my world. Imagine you're caring for a fragile, premature baby, worried that they have a heart condition that could threaten their life. For a baby like this, a timely diagnosis can make all the difference. Now, right now, the best technology we have to do that is an ultrasound of the heart called an echocardiogram. Now, even with this technology, there remains a big hurdle. These images still have to be interpreted by a pediatric heart doctor, and there are far fewer of those, and there are babies who need them not only in the United States, but around the world. But to just really highlight how nuanced some of these findings can be and just how important these doctors are, I'm gonna play a quick game with everyone. So if there's any heart doctors in the audience, or I guess artificial intelligence, please sit this one out. So here are two echocardiograms from two different babies. One is completely normal, and the other one shows a critical heart disease that requires surgery immediately after birth. Can anyone here tell me which one's a bad one? I'm hearing pretty 50-50 left or right. For everyone who's playing curious, it's the one on the right, actually. Don't be ashamed if you pick the one on the left. Experienced doctors, even me, have a hard time interpreting this data. But that's really the point that I'm hoping to make, is just how crucial this interpretation is. And not only that it's accurate, but in a timely fashion. Because while we're all playing a game right now, for this baby on the right, this was a matter of life or death. But what if AI could bridge this gap? What if it could interpret images when doctors are unavailable or simply lack the skills to do so? Sounds a little bit like a stretch, right? But here in Atlanta, these are actually the exact AI-driven solutions that we're working on. Building models that can interpret data like this to provide doctors like me the information they need to take care of their patients. Not because it's cool, but because it could potentially save lives and improve access to care. So let me take you into the heart of my work. So our team is focused on a common and critical heart condition called a patent ductus arteriosus, or PDA for short. Now, what it really is a small blood vessel that lives just outside the heart. And when babies are born every day, it closes on its own without any intervention. However, for those babies that are born premature, this doesn't actually happen. And so it's up to doctors like me to figure out if it will happen or if we need to do something to make it happen. Because if we leave this untreated, it can cause lots of problems in premature babies, like trouble breathing and too much strain on the heart. So right now we have a couple options. We can just watch and wait. We can give the baby some medicine that's not without side effects to try to close it, or even in some circumstances, we need to take the baby for open heart surgery to do so. Now, really, the best tool me or any doctors like me have at this point, other than those echocardiograms that we talked about, is just watching and careful observation. But our AI model really hopes to change that. What it does is it takes the data from those echocardiograms without the need of a pediatric heart doctor, interprets them, and is able to predict whether the PDA will close with medicine or not. And early results show that the model not only works, but it actually works better than anything out there right now. But this is really just the beginning if you think about it. Imagine applying the same technology to other heart conditions like the one we talked about in the game. Imagine using it in areas of limited resources, both in the United States and around the world. This is the future that we can create with AI. But before I get too excited, we should probably talk about the elephant in the room, which is, can we trust AI? Everybody here probably has been following the news, and you all know about the dubious, shall we say, actors and characters that are involved in this space. It's really enough to make anyone skeptical, even me. But despite my reservations, I do believe AI can be trusted if it's developed with humility and guided by the interest of patients. So just a little bit ago, I said our model works better than anything out there, which is true. But 27% of the time, it is completely wrong. The humility that I'm talking about is in holding both of those truths, that a model can potentially be groundbreaking, but also could be deeply flawed, and not letting those flaws discourage you, but rather to motivate, to push forward, to iterate, to improve. Because ultimately, here's the key. Even an imperfect model can still provide help to a doctor. Our model gives information to doctors that they otherwise wouldn't have, information that they need to take care of the patients that need them. Because we should really all be thinking about AI in medicine a little bit differently. It's not meant to be the sole decision maker, or it's not meant to replace people like me. What it should be thought of is as a collaborator, a tool, something that can help doctors and nurses make faster, fairer, and better decisions. Because the thing about artificial intelligence, it's really not the intelligence. It's the space that it creates for humanity. If a nurse isn't tied to the monitor, they can spend more time at the bedside, counseling that family, letting them know that their baby's gonna be okay. But when a physician isn't buried in paperwork, they can spend more time at the bedside, practicing that art that they spent their whole life, and trust me, I mean their whole life, to learn. Because AI isn't just about saving time, it's about the space that it creates for compassion. So right now, decisions are being made all across the country and the world about how this technology will be applied in the medicine that we practice. Now, it may feel like no one has a voice in this and you just kind of have to sit by and let it happen, but trust me, it's not just being shaped by researchers like me or hospitals that I work in, it's being shaped by all of us. So at this moment, no one in this audience can afford to be passive. So here's my challenge to everyone here. Next time you're at the doctor's office, ask about AI. Ask about how it's being used in your care, because trust me, it is, and ask about how it's being used in the care of your community. When you're at work, even if you don't work in a hospital, you should be pushing for ethical practices around technology and how it's deployed in your workplace and your community. And most importantly, at the ballot box, you should support initiatives that promote transparency and fairness in this technology. Because the future of AI is being written right now, and it's up to everybody in this room to make sure that's written by us and for us. Because ultimately, it's not about choosing between AIs or human, it's about collaboration. It's about building that future that I described, where AI can enhance care with integrity, with purpose, and with compassion. Because together, we can redefine care. Together, we can all build a healthier future. Thank you.